have had a gastrointestinal infection. I bet that all of us have had either diarrhea or the common flu at some point in our lives. How about any cavities or pain related to your mouth? Most of us have suffered that, and it's really uncomfortable and painful, right? What if I told you that there are simple and easy ways for you to prevent these painful and uncomfortable situations? Lack of personal hygiene is a serious problem that can be solved by simple action. In this speech, I'll be talking about the problems that arise from unattended personal hygiene, as well as maybe tips that can help you have proper personal hygiene, which include hand washing and dental care. Okay, so now that I'll be talking about the problems caused by not washing your hands. So there are about 800 transmitted infection diseases that can just be transmitted by simple contact. According to the Center for Disease and Control, bacteria and viruses live on surfaces for 2 or longer hours. These germs will cause gastrointestinal infections, like I mentioned before, the common diarrhea, influenza, and hepatitis A. Almost 50% of these airborne illnesses can be prevented if we just wash our hands constantly and maintain personal hygiene. There are about 200 different viruses and bacteria that only affect the common flu. So imagine all the other diseases. These are multiple viruses and bacteria, and just 200, around 200, affect the common flu. These are highly surprising numbers, right? They're really high, and it's so weird to think that they could be prevented by taking simple action, by just washing your hands, coughing, covering your mouth when you cough, wash your hands after using the toilet, handling animals, and that sort of things. Okay, so now let's move on to another important point, which is dental hygiene. Dental hygiene causes a lot of discomfort as well. For instance, there is this whitish layer that forms on top of your teeth, and this causes tooth decay. So what it does, it's acid that it's eating away the protecting layer of your tooth. So then it makes your teeth, more sensitive. It makes it uncomfortable to eat and all that, stuff that you do with your teeth. As well as there's the also common known disease called gum disease, which is just the constant formation of the plaque that forms in between the supporting bone between your jaw and your tooth. So what this does, it just loses up the muscle and the strength that holds it together. So it causes the loosening of teeth as well as falling off of your teeth. There's also the social acceptance, which we put a lot of importance to. Your teeth are really important when it comes down to your appearance and everything, socially acceptance. So your teeth are really sensitive, and they tend to stain with beverages such as coffee, tea, among other common beverages. This also pertains to bad breath, which just overall it's socially acceptance. We don't like to have bad breath, or and this retains us and limits us because we are afraid of our appearance. So in order to prevent these issues, and not just for you but for your loved ones, it only takes about 10 to 20 seconds in order to have proper hand hygiene. These, like I mentioned before, these germs, if transmitted, will contaminate and cause gastrointestinal infections. It is recommended that you use warm water when you're washing your hands, not only because it will help the ingredients in the soap to activate quicker, faster, and it works better without stripping away your natural oils, so it won't irritate your skin. It is also recommended to use liquid soap in public areas due to the fact that it limits germ contamination. It's highly suggested that you wash in between your fingers, in between your nails and your skin, as well as the back of your palms, because these are the main areas where you contain germs. Okay, so now we'll talk about steps to follow for dental care. According to Richard Price, the spokesperson for the ADA, which is the American Dental Association, he suggests that it is recommended to brush your teeth twice a day, mainly in the morning, at night, and it only takes about 3 minutes for you to have proper care of your mouth. as well as flossing after every meal, and using products that are ADA approved. It is recommended as well to change your toothbrush every 3 months. It's not necessarily because of the germ contamination, but the purpose of the brush. You know, like there's this a setup for the brush, so as soon as you see, you know, like the bristles pointing different ways, then that's a sign for you to change your toothbrush. Germs mostly live in moisture environments, so you're okay when it comes down to, you know, like being scared about germ contamination, using toothbrushes and stuff. It's okay as long as you use your toothbrush when it's dry. So since germs tend to live in moisture environments, by this time they're already dead. So it's not like they're, you know, still there. So like I mentioned before, these are simple and small steps that we can take in order to prevent maybe future, you know, health issues, and prevent, you know, like our family ones to be sick, for you to, you know, like maybe you're unable to attend an important event because you're sick, you know, so just think of all these situations. Dental hygiene also protects you against cavities, tooth loss, decay, you have brighter teeth, fresher breath. In conclusion, these precautions are easy. So next time you're in a rush, you know, after using the toilet, just think of all the complications that could come from you not washing your hands. It will only take about 10 to 20 seconds and about 3 minutes and twice a day in order for you to have a healthy mouth. Now that you know all these easy steps, hopefully you will follow these easy and simple precautions in order to not only protect yourself, but those around you. Thank you.